Hi, I'm Dr. Malpani. I'm an IVF specialist, and today I'm going to talk to you about the infertile man. This is actually a very simple problem, but in some senses it's also very complicated, and I'm going to explain to you why. Now, everyone knows that you require a man in order to produce a baby. That's not rocket science. And obviously, if you studied your high school biology, you know exactly what the man has to do in order to get his partner pregnant, and I'm going to review that again for you. So I'll tell you then what is required, and then I'll tell you why this sometimes becomes such a complicated problem when the couple is infertile. So let's first talk about normal male physiology and a normal fertile man. So a man's reproductive apparatus is relatively straightforward because it's all out in the open, unlike a woman's where the uterus and the vagina is all hidden inside and no one knows what's happening. So the most important structure, of course, is not the penis. The most important structure is actually the testis, and this is what the testis looks like, what's colloquially called the balls, which are in the scrotum. Now, the testis is where the sperms are produced. That word for sperm production is called spermatogenesis, and right now we're talking about a fertile man, which means his testes are in the scrotum, the normal size, and they produce lots and lots of sperms every day. And these sperms, which are then produced in the testis, will keep on getting manufactured, and then they will keep on getting collected. And when he then ejaculates, which could either be at the time of masturbation or whenever he has sex, so that's a slightly different procedure, and people often get confused between male fertility, which is the process of sperm production, and male sexual performance, which is obviously erection, and ejaculation, which is sexual potency. They often go hand in hand, and obviously for the fertile man, everything is fine. He's producing lots of sperm, and he gets an erection, and he ejaculates. But for some men, that doesn't happen, and I'll come back to what we need to do in case there are problems. So all these sperms are merely being produced, but then when they reach a certain critical threshold, or for example, whenever he has sex, then ejaculation occurs. What does that mean? The man gets sexually aroused, he gets an erection, and when he gets an erection, the semen will get ejaculated outside. What does an ejaculate mean? It means that the semen gets discharged. Now, there's a difference between sperm and semen. Semen consists of seminal fluid which contains sperm. So the sperms are really the millions and millions of them, but because they're so microscopic, the amount they actually constitute in the seminal fluid is very, very little. And that's why it can be so misleading, because even if your semen looks fine, your seminal fluid looks fine, and really all a man can judge is whether he gets an erection, whether he can ejaculate, and whether his seminal fluid is fine or not. He obviously doesn't have a microscope at home to check whether there are sperms inside his seminal fluid or not. And that's sometimes a bit of a problem. So let's assume everything's fine. So the sperms are being produced, they travel here. This is the testis. There's a little structure on top of the testis called the epididymis. Long word, don't worry too much about it, but basically what it serves as is the swimming school for the sperms. Because when the sperms are being produced in the testis, they're produced in what are called seminiferous tubules. These are what seminiferous tubules look like when you examine them under the microscope. So there are lots of immature sperm cells, what are called spermatogonia and spermatocytes, lining these seminiferous tubules. And then as they mature in a process called spermatogenesis, which usually takes about 6 weeks, these will then form sperms. These are called spermatozoa. And remember, the sperms in the testis are not motile. Obviously, there's no point in them moving at all. And then from the testis, they then move on to what is called the epididymis, which is a little structure sitting on top of the head of the testis, where they learn how to swim. That's why I said the maturation process occurs inside the epididymis. That's here. And that's why that's a swimming school. And then they acquire some motility, and then at the time of ejaculation, they will travel through the vas deferens, pick up a lot of additional stuff, for example, prostatic fluid from the prostate, as well as fluid from the seminal vesicles, and that entire mixture will then come out as semen only through an erect penis. And that's called ejaculation. And if the ejaculation occurs inside the woman's vagina, and if she ovulates at that time, which means she produces an egg at that time, the sperm and the egg will meet, fertilize, form an embryo, they have a baby, and that's a happy ending. So let's come back to a little bit about what happens in the testis for sperm production. And again, I need to emphasize, it's very difficult for a man to know whether his testis is producing sperms or not. A doctor can have certain suspicions that something is off. So for example, if a child's testes are not descended in the scrotum, what's called an undescended testis, which means the testis is absent, or the testis is very small, then the doctor can suspect that there's something wrong with sperm production. But often the only way to actually make that diagnosis is after the semen analysis report shows that there's no production of sperms at all, what's called azoospermia. Then we do an additional procedure called a testis biopsy to find out what's happening. That of course becomes a little more complicated and lengthy, and I'll come back to that afterwards. So just a quick review. As far as the man is concerned, the testis is where the sperms are produced. They then travel through the epididymis and the vas deferens, and then they go out through the erect pelvis. Now, if there's a problem with sperm production in the testis, then he will not have good quality sperms. Or if the epididymis or the vas is blocked, then the sperm count will be 0. I think that's important to understand. If there are some sperms, even if there's just 1 million sperm, there obviously cannot be a block. There can't be anything like a partial block. So as long as there are sperm, this straight away rules out the fact that there is no block. And if there is no block, then you don't need to waste money on doing, I was going to use the word stupid procedures, but expensive, pointless procedures like transrectal ultrasounds and all kinds of fancy ultrasound studies, because that's not going to provide any useful information at all. So if there are sperm in the semen, that means there is no block anywhere. And then we need to actually look at the semen analysis report to find out what the problem is. Are there sperms? If there are, then is the count okay? Is the motility okay? And that requires a little more analysis, which is what infertility specialists are meant to do. There are lots of additional tests which can be done. The important thing is that if the semen analysis report is normal, the man does not need any more tests. Let me keep on emphasizing this. The problem with the sperm test, of course, is the question is not what is my count or what is my motility. The question is, can I get my wife pregnant with these sperms? Sadly, we can't answer that question. Now, that might seem a little surprising. What simple question? All we need is a simple answer. What we can do is we can measure the sperm count, we can check the motility, but we can't check sperm functional competence. We can't check whether the sperms are capable of working or not. That comes as a bit of a rude shock for patients, and doctors are often not very honest. And then when the man has a problem, they will often do lots of additional tests. It's a long list. Sperm DNA fragmentation. In the past, they would do additional tests like hypoosmotic swelling test or zona-free hamster assays in order to find out whether those sperms work or not. The problem is there really is no good test for that. The only way to find out if the sperms actually work or not is by doing an IVF cycle, which means you put the sperms and the egg together in a test tube in the IVF lab to find out whether they work, which is obviously a very expensive way of answering the question, which is why usually our suggestion is that if the sperm count and motility are normal, it makes much more sense to assume that the sperms are functionally competent and the man is fertile. If you have more questions about interpreting a semen analysis report, or you just want to find out more about all these long words like epididymis or vas deferens, please go to our website, which is www.drmalpani.com. We've got thousands of pages of information, hundreds of videos designed to educate and inform you so that you make well-informed decisions in partnership with your doctor. Please understand, we're not trying to replace your doctor, we're trying to supplement your doctor so that your doctor and you both can decide what needs to be done so you get the best possible medical care. And I'm happy to offer a free second opinion on our website. You just need to email me at drmalpani.com. And if this information therapy helps you to have a baby, nothing will give me more joy and pleasure, because that's the reason I became an IVF specialist, to help infertile couples to have a baby. See you online at www.drmalpani.com.